How long have you been mindlessly scrolling on social media until this video appeared in your recommendations? Before you answer, let's take a few minutes to discuss one of the world's most overlooked issues, adolescents' mental health and social media. First, let's put things into context. The Economic Times defines social media as online networks where people share ideas, information, and opinions. According to the WHO, mental health is a state of mental well-being that helps people cope with the stresses of their life, learn well, and work well. Furthermore, adolescence is the phase of life between childhood and adulthood, from ages 10 to 19. So what is happening? In 2023, the International Journal of Environmental Health and Public Health published a review illustrating how increased social media usage in the pandemic, specifically 45% of adolescents reporting being chronically online, had impacted their mental health. They suggested that the accelerating social media usage resulted from COVID-19 social distancing practices, and in some cases, parents were unable to monitor adolescents' social media use. How does this impact an adolescent's mental health, you may ask? Firstly, as indicated by the review, the relationship between COVID-19 stress and depression was most prevalent among adolescents who reported the highest social media use after the pandemic, as opposed to adolescents with lower average use. Secondly, regularly scrolling through social media interferes with sleep quality and quantity among adolescents. According to Dr. Michael Bruce, exposure to blue light from electronic devices may cause trouble falling asleep, waking up early than anticipated, and disrupted sleep. Thirdly, adolescents use social media pages to present ideal image with carefully selected photos. When the photos do not receive the likes, shares, and comments they expected, they may wonder why another's posted photo or content receive more attention and positive responses than their own. In other words, they are experiencing low self-esteem. However, as stated by two studies, we should not dismiss the positive influences social media has brought. This consists of using social media as a coping mechanism through humoristic content, offering a sense of connection and support throughout the pandemic as a result of social distancing practices, and educating adolescents to promote mental health. But how aware are people of this situation? We surveyed a small group of adolescents and received 14 responses. According to the results, the majority of respondents spend at least 3 hours on average on social media, and they all use social media for entertainment. We observed that respondents are frequently exposed to harmful content on social media, and around 71% of them feel depressed, traumatized, and hopeless, and they didn't want to do anything for the rest of the day when dealing with such content. A large proportion of respondents, specifically 92%, said positive information impacted their mood positively. How is the situation unfolding in specific countries? We decided to investigate South Korea, where adolescent mental health issues have been identified as a severe social problem over the last decade. According to the Korean Disease Control and Prevention Agency, Korean adolescents spend an average of 285.2 and 397.1 minutes daily on their smartphones, proportional to the increase in social media use. As a result, South Korean adolescents are heavily influenced by social media standards, as observed by several studies. An example is the frequent usage of keywords in blogs related to diet and obesity, indicating adolescents' significant interest in their bodies. Content on the social media app Kakao, which promotes eating disorder behaviors, including the Korean culture of mukbang, also plays a role in shaping Korean adolescents' mindsets. Another contributing factor to mental health issues due to surging social media consumption is cyberbullying. In South Korea, this commonly takes the form of sexting, also known as cybersokokryok. The COVID-19 epidemic, in particular, has increased the occurrence of cyberbullying. For Global Insights, we interviewed Dr. Paul O'Halloran, who is currently the Deputy Director at the Mental Health Care Center at Vinmex Time City and has worked in the psychology field for over 45 years, occupying positions in Australia, the United Kingdom, Europe, the Americas, and the Middle East.
After the COVID-19 pandemic, do you think social media has become a leading factor in mental health problems, specifically in adolescents? If so, then why?
Look, I think the COVID pandemic had a worldwide detrimental impact, not just on people's physical health, obviously, but the whole process associated with the unknown, the uncertainty about this new virus and its potentially lethal impact on individuals, on families, on countries, on culture. That was a phenomena around the world. And I think particularly young people who were attending school both in my home country of Australia, but I understand it to have happened here, was suddenly forced to adapt a whole new way of learning and teachers teaching. A lot of disconnection and isolation, and a sense of social connection I think is a very important part of our mental health. Coming back to the aspect of the impact of the internet, I think adolescence is a time of change, both physiologically but also psychologically, sociologically. It's that rite of passage from being a young person into an adult. And often, in my experiences, people get stuck in those big transitions from one life stage to another. With the internet, what you have is both, I would say, benign influences. It's a very positive thing, but there's a lot of malign influences as well, malignant, damaging influences. And apart from the obvious ones in terms of straight out misinformation or pornography or all of those things, there's just also a confusion of choice about what's important, what's the meaning, what's the direction in life. And I think that can be kind of confusing and overwhelming without guidance. So I think, yes, COVID definitely was a precipitator, but it only amplified perhaps what was an underlying situation. It made things worse, particularly because of the social disconnection through quarantine and isolation that was required.
Do you think the benefits of social media to adolescents' mental health outweigh the disadvantages?
By and large, I think social media, and I take social media to mean the broader term, which it would include the internet. Whether you define it more simply as Facebook or equivalent, I'm not sure. But if you, I suppose, zoom out and look in a larger perspective, the internet has been a good thing. It connects us with the world. We've never been more connected. We've never had better and easier access to instant knowledge. So all in all, I think it's a good thing. However, not to be naive, being connected to the world, that opens the door to not just benign, good influences, but malign, malignant influences. And I think it's very hard to sometimes tell which is which and how they affect you over time. So I think that comes with experience, it comes with a good sense of judgment, it comes, I think, with knowing your own values and what's important, and being able to make judgments around what is helpful for you and what is hurtful for you.
Although social media is undoubtedly a crucial part of our lives, many fail to recognize the detrimental impact it has on mental health, specifically among adolescents. Adolescence is a time of change, both physiologically and psychologically, and there's no clear roadmap about how you get across that bridge from being a young person to an adult. This is why the interference of social media could be misleading during such times. We believe the current situation shouldn't be neglected, but rather be prioritized. Therefore, we asked Dr. O'Halloran for his advice to adolescents on how to overcome this barrier.
As a psychologist, how do you help adolescents going through their mental health problems?
I think the first thing is to create, I suppose, a situation of acceptance that, in a sense, mental health issues are normal. They're not something outside the range of normality. Everyone, whether they admit it or not, everyone in their life has some mental health issues, whether it be grief from losing a loved one, whether it be extreme sadness over not achieving what you expected to achieve, feeling anxious about life ahead. Everyone has those range of emotions. So that's the first thing. I think the second is trying to work with the young person, try and define what the problem actually is. Sometimes that's not always obvious. Sometimes the person's, in a sense, struggling to find out, what's my issue, what's my problem. And the thing with adolescence, I think, is that yourself is changing. It's, growing into an adult, not just physiologically, but psychologically, emotionally, and that's a big transition. So finding that relationship with yourself about who you are, sense of identity, what's important in life, what's the purpose, that sense of connection with others, belongingness, learning to understand yourself and learning the techniques to look inwards and understand yourself, let alone just looking out on the world. But then it's our relationship with others. We're social beings, whether you're an adolescent, a child, or an adult. This deep down desire to belong. But that sense of belonging with family, with friends, with loved ones, I think is really an important part of belonging. And in adolescence, obviously, the body is changing the most dramatically it ever will. So we need to look after our body as much as we need to look after, if we're going to expect to have good mental health. And the biological components of mental health are good sleep. It's also about nutrition. It's a confusing time in the world, both for young people as well as adults, about what does science say about nutrition, what's good for us. So I think sleep and nutrition, and the third thing is exercise.
Thank you for listening, and until next time.